Hey guys, welcome back to my channel. If you guys are new here, my name is Nkenna. I am responsible for everything that goes on here. As you guys can tell from the title of today's video, we are going to be talking about 5 apps that I think are absolutely necessary while in nursing school. Going ahead and diving right into the materials, the app that I would recommend is PickMonik. PickMonik has been a game changer for me. I did not come across it until my second semester of nursing school. A friend had actually told me about it and I had seen them at some nursing conventions. So I finally decided to, explore, see what the hype was about, and I'm really glad that I did actually. Essentially what PickMonik is, breaking down the name from what I think, I could be completely wrong, but just my interpretation. So pick, pictures, and then you think of mnemonics. Mnemonics help you remember things. It's like catchy phrases that help you remember different things. So there are a multitude of them for nursing, but they use pictures. So catchy, cute little funny pictures that help you remember a lot of the nursing concepts. What sold me on PickMonik was that for med-surg, my textbook that we use for school, they directly had it linked. You can choose from a number of textbooks, but I saw my med-surg textbooks among the list of books that you could choose. I chose it and I did different quizzes particularly tailored to different chapters, different content areas, and I really noticed a difference in my grades once I started pairing that along with what my professors were giving me. It was just a really good way to pair it up with studying. Every day you can do a quiz of 52 questions. It's a random questions, and I think that this is ideal, particularly for students like me who have that 3-month gap between spring semester ending and fall semester beginning. It just keeps your mind fresh, and it's a good way to review some of those core concepts that you're scared that you might lose just because you're not looking at them every day, you're not studying them every day, you're not applying them every day. I'm gonna pause that. It's this video for digoxin is 1 minute and 42 seconds, and it breaks it down to the mechanism of action, the indications, side effects, contraindications, nursing considerations, and all of this information you're gonna get in 1 minute and 43 seconds. So for me, I have a very small window for my time span, my attention. So, I gotta get it in quick bursts so that I can remember. So I really appreciate that the videos are very short, concise, they're to the point. You get the information that you need. There's no extra fluff. It's just giving you all of the need to know information in just short bursts. So absolutely, most definitely would recommend, 10 out of 10 would recommend to anybody to definitely get a PickMonik subscription. I'll make sure that I put all of my information down below if you do want to sign up for a PickMonik subscription. So the next app that I wanted to tell you guys about is ALARMY. As a nursing student, I know that it can be really hard. You study long nights, you have to wake up early mornings, especially for clinical or reporting for lectures. Just lots of different things that you have to do. So it's very hard to get quality sleep while you are in nursing school. However, that also makes you prone to oversleeping. With the ALARMY app, it looks like any other app, like the iPhone app, where you go in and set your alarm. However, the only difference is you have to set an obstacle, so to speak, that makes it that much harder to oversleep. So when you're going in and setting up the alarm, then at the very top, it says the time that you would like to set the alarm for. Next up, it has a mission, so to speak. So when you click on mission, then it says default, it has shake, it has math problems, it has take a picture, it has barcode, memorize game. I'm most familiar with our shake. So you can set it to shake, and it says shake 30 times, and you have to shake your phone vigorously for 30 times until it registers it, and then that's what turns off your alarm. So you can imagine you're sleeping, your alarm goes off, and you have to shake it vigorously like this 30 times, or you can set it to whatever you want. I think you can do it less, you can do it higher, and then you can also increase or decrease the sensitivity of the shake. So you can make it so that you only have to mildly shake it, or you can make it so that you have to heavily shake it. And then once you reach that goal, that's what silences the alarm. Definitely my obstacle of choice would be math problems. You have to answer any number of math problems. I believe you can do 1 all the way up to whatever amount that you want to do, but you can do math problems. You have to solve it correctly, and you can start off super easy. So the example they give is 3 plus 4. You can do very easy, 23 plus 17, and then you can always do all the way up to very hard, where it is a multiplication. It's a PEMDAS problem. So it has parentheses, multiplication, and then it has addition on on the end. So you can change it from any variety, but the thing with that is I like to typically do 3 problems, because by the time I've done 3 problems that are anywhere from normal to pretty hard, I've really had to like maybe sit down, get out some pen and paper and figure out the problem, and it's gonna keep ringing. The alarm is gonna keep going off until you get it correctly. It's not gonna momentarily silence, so you have to get it correct for this in order for this to turn off. The next app that I would recommend is called the Grades app. So for a lot of people in nursing school, you're in programs where you have a minimum test average that you have to achieve, and before they factor in any other grades, you must achieve this. So in my cohort, in my program, you have to achieve a 75 test average before they factor in anything else. So the Grades app came in handy first semester of nursing school when you're trying to figure out where you stand and figure out the test averages, and you have all these different percentages for each exam. So a good example that I would use is in med-surg this semester. We started off with the first test. In patho, it was the same way. The first test was weighted less than all of the rest of the tests. So we had a total of 6 exams. First test was weighted at 10%, exam 2 through 5 was weighted at 13%, and then exam 6 was weighted at 18%. So with all those different percentages, it gets a little confusing, it gets a little muddied. So with the Grades app, you go in, you put in the actual class itself, you can put in the percentage that each exam is worth, you put in your target grade. So of course I want to do better, I want to get all straight A's, do very, very well, but I put in the target grade as 75. So that lets me know what I need to do throughout the semester. So as I'm taking these tests, I put in my test grades and then it adjusts. So it tells you after every test if you say you want to get a 75, or let's say you don't want to just get the minimum, you want to make sure that you get straight A's this semester. If you put in that you want to make a 90, then it'll tell you on all these subsequent tests you need to make an 88, or you need to make a 95. And then as you keep going in, let's say it says exams 3 through 6, you need to make a 95. So then you go on your next test, you get 100, blow it out of the water. Then it drops that average and it tells you that maybe you only need to get 87 on the remaining tests. So it lets you know, and then that way you have a good idea going into final exams what grade, where you stand, and then what grade that you need to get to achieve that final grade. So I used it when I was taking Patho Pharm, and I went into final exams knowing that I could get a 52 on the final and get the grade that I desired on the class. So I think it's really good just for knowing where you stand, not having that anxiety, and just being able to keep yourself accountable throughout the semester and not getting to the end of the semester and then finding out that you needed to get a 235 on the final exam to remain in good standing in your course. The next app that I wanted to mention is the FLORA app. The FLORA app is essentially an app that keeps you on task. So what the FLORA app allows you to do is to set a block of time that you want to study for. I usually do anywhere from 25 to 50 minutes increments, and then I give myself a break. I might say anywhere from 5 to 15 minutes, allow myself to eat a snack, walk around, take a bathroom break, check Instagram or something, respond to emails, and then I regroup. So you can use this as an accountability system by inviting your friends to your room. And once you're in the room, then everybody, put your phones down. It's on a time limit of 25 minutes. And the catch is that if anybody tries to go out of the app, go to Instagram, go do whatever it is that they're doing, play Clash of Clans, whatever it is that people do these days, it kills the tree. So the whole goal is to plant a seed, it grows a tree within 25 minutes, and then once you're done, you see your elaborate garden, and the more you do it, the bigger and more beautiful that your garden is. The final app that I think that everybody should have in nursing school is Nursing Central. I was introduced to this app through my nursing school because they did pay for a 2-year subscription for us. So within this application, it's pretty much everything that you would need, and it's really good, especially when you get to clinical. I've found myself many times pulling out my phone, quickly checking like what a medication is, or what are the contraindications, or what is that medication being used for, just really quick to refresh my memory, or maybe I've never heard of it, and then I put it back. So the 2 main tabs that I would say that I use are the drug guide and then also the diseases and disorders tab. About anything that you need to know on this app, it's a good pocket resource. And when you pull it up, then it shows you an actual picture of the medication. It has the trade names, the therapeutic class, the pharm class, And then it says indication. Sildenafil, if you didn't know, is Viagra. So sildenafil can be used for erectile dysfunction, but then it can also be used for pulmonary hypertension. So in the instance that it was mentioned during report, it was being used for pulmonary hypertension. Further subdivided, it has indications, the action of the drug, it has the therapeutic effects, the pharmacokinetics, contraindications and precautions, adverse reactions, interactions, routes and dosages, and patient and family teaching. So it really has everything and anything that you could ever quickly think of that you would need to know about maybe a drug or a disease process in an instant.